Hi, my name is Muath Bishawi. I'm a Clinical 3 I-6 resident in the Division of Cardiothoracic Surgery here at the Department of Surgery at Duke University. I chose an integrated cardiothoracic surgery program for a number of reasons. I think one is that I knew early on I wanted to be a cardiothoracic surgeon. I've tried many different specialties on for a fit, and cardiothoracic always stood out as the one that best kind of suited my interests and the best match for really what I wanted to do with my life. In regards to why integrated programs versus kind of going the more traditional route, I felt that the integrated programs had a lot to offer in terms of unique skill sets and trainings in other specialties such as echocardiography and cath lab, where it will provide me with kind of new tools that are being used readily currently and will be used in the future in training kind of not just present cardiothoracic surgeons but future cardiothoracic surgeons to deal with patient issues as they arise. I felt like Duke was the right program for me for a number of reasons. One, it had an incredible case mix and high volume of different cases within cardiothoracic surgery, whether it's transplantation, adult cardiac or congenital cardiac surgery. Also, I think it had a nice mix of different levels of mentors, whether it's co-residents, senior co-residents, junior faculty, or senior faculty. And then the academic ability to become an academic surgeon and the support to become an academic surgeon here was really unparalleled. It would kind of highlight the decades of previous trainees and where they are today. So it really provided with a list of these folks, and you get to see what a polished Duke trained cardiothoracic surgeon looks like. All these factors were important for me in choosing this program as my #1 choice for training. So, at Duke, after our second clinical year or third clinical year, we have the option to go into the lab to kind of get additional training in kind of either in research in a research laboratory or some other kind of unique opportunities. And for me, I've always liked mechanical devices and within cardiac surgery, and I chose to do a PhD in biomedical engineering here at Duke. It was really an incredible opportunity where I got to work with a number of different engineering faculty here on developing unique model systems to studying a number of different topics related to cardiac disease. One of those have led to kind of a discovery in mechanical fluids that allowed the development of a new and unique catheter that has advantages over the current catheters on the market. So Duke really provided me with first the training to pursue some of these interests, but also once we were at a stage where we spun out the company, there's a lot of local support in both finding private investments in launching the company and getting our product through the regulatory path, but also helping to run the company as I can transition back to clinical residency. In terms of research, getting a PhD I think gave me the skill sets that I need for really pursuing true academic cardiac surgery in the future, where I would get to have a lab and run a lab at the same time that I have a clinical practice. I think my surgical training has been, for the most part, unparalleled. Whether it's on the cardiothoracic surgery services, where we get to really run our own service with our faculty member that we're assigned to for that rotation, and kind of going through step by step how to develop the skill sets to perform these operations, and not only that, but also care for our patients in our ICU. The support, whether it's from our advanced practice providers or our faculty or co-residents, has been incredible. But also I would like to also highlight the experience, the surgical experience on the non-cardiac surgery services, which has also been fantastic. So, for example, this month I am the chief resident on a general surgery service, so really getting that chief experience outside of cardiothoracic surgery has also been incredibly helpful. Managing interns and running the service and dealing directly with faculty who really treat you as a junior colleague has been really a wonderful opportunity. I think it's very unique to Duke, where I think a lot of integrated programs are missing the very strong general surgery component of their training, and I think that really is an important part of our program here at Duke. My future career plans involved being an academic surgeon, so having a clinical practice focused on surgical heart failure and adult cardiac surgery, as well as having a lab where we get to study a number of different, whether it's new therapies or new models to study important questions in cardiothoracic surgery. And then finally, the ability to spin out or improve on technologies to help improve patient care. So it's a combination of those three, and really the training I've been receiving here at Duke I think gives me a unique skill set in having at least a chance at being successful at doing so.